Good morning, ladies and gentlemen. Welcome to another episode of Monitor Your Health. On this program, we educate the public on contemporary medical conditions. My name remains Dr. Femi Ogunremi, and we will be talking on the topic apnea, which is, some people call it snoring, but we're going to learn a lot about it today. It is obvious that there are so many people that suffer from this condition, but unknowingly, they just carry on. At mid-age, about 9% of our women will suffer this, and about 24% of our men suffer apnea. In order for us to, throw more light into it and to enlighten us about it, we have a general practitioner from, Australia, Dr. Michael Mbaogu. He has been with us before, and we really appreciate him so much. Dr. Mbaogu, you're very much welcome to the program.
Thank you very much, Dr. Ogunremi.
Thank you. I think we know you now, but you might want to tell the audience who are meeting you for the first time about you, and then we'll go into the question.
I'm Dr. Michael Mbaogu, a family physician or general practitioner in Queensland, Australia.
Thank you so much, and we really appreciate your time because we shouldn't take that for granted. So, snoring, apnea, not able to sleep. There's so many things that people, talk about, and then we want you to help us to throw light at this today. What do we mean by apnea?
Okay, thank you very much. Before we talk about apnea, I suppose we should probably talk about snoring because you started by talking about snoring. Snoring is basically the sound produced by the soft tissues of the airways, upper airways, during sleeping. And the soft tissues of the airways, they are mobile. They actually relax during sleep. And they have to, so that we are able to breathe during sleep. And also that is a problem because the muscles and the tissues in the upper airways relax during sleep. They can produce vibratory movement, producing sounds that we know as snoring. So that is to be distinguished from apnea, which is complete cessation of breathing during sleep.
Okay. Thank you so much. So, snoring, apnea, they're not the same. Clearly, we now know that. Now, so what do we then mean? You talked about complete cessation of sleep. Can you tell us the mechanism of what we actually mean by this, this condition called apnea?
Okay. Again, I would like to go back to snoring because even though I've sort of tried to explain that snoring is completely different to apnea, a lot of people still make that mistake. Most people who snore don't necessarily have sleep apnea. And like you said, Dr. Ogunremi, snoring is actually very common. Up to 45% of humans do snore from time to time, and 25% of humans are habitual snorers, if you will. Habitual in the sense that they snore for more than 3 nights a week, and that is not apnea. So they still are able to maintain their airway, but in apneic episodes, there is complete cessation and the breathing stops. And there are a few factors that can cause that to happen, to come about. And one of the commonest factors, Dr. Ogunremi, is being a man. We know that men are, about 3 times more likely to have sleep apnea than women, and the prevalence of that increases with increase in age, such that middle-aged men are more likely to suffer sleep apnea than younger men and women. other things like obesity, being fat, being big, people with a BMI, the ratio of their weight to their height greater than 34, we know that they are more likely to have sleep apnea than most people. And there are other factors as well. People have spoken about race. Yeah, so it's common in non-Caucasians, particularly so in Black people than Caucasians. So that has to be taken into account as well. The size of the neck that closely links in with obesity is also very important. So men having a neck circumference greater than 43 centimeters is significant in terms of sleep apnea. And there are also other factors that come into play as well.
Okay, thank you so much. So we now understand that there are associated factors or associating factors that will, make an individual prone to this condition. But how do we actually know if, somebody will be sitting down there that I snore? How do I know whether this is sleep apnea? How do we know? What are the signs? What are the symptoms that we see that make us think, oh, maybe I'm suffering from sleep apnea?
It can be difficult to tell, especially if you're a layperson, if you're not trained, and that is why you need to consult your physician. But we also rely a lot on the information provided by sometimes the patient, but more importantly, their family and partners, because the patient oftentimes don't know what's happening to them when they're sleeping. So oftentimes the snoring, it may not be a problem to the patient, but more of a problem to their partners or roommates or flatmates or the likes of it. So the symptoms we look out for, and I think I have to say this, Dr. Ogunremi, like I said, a lot of people do snore. Up to 50% of us do snore from time to time, and that could be related to things like alcohol consumption prior to going to bed, things like smoking, even taking sedatives, medications can lead to snoring. And there are also anatomical structures. For example, there's what we call tonsils in the upper airways, if they are enlarged, or even the adenoids, and also in the nasal passages, if one has a deviated nasal septum, that can affect and narrow the airways and obviously cause a bit of sound during breathing, and more so when one is sleeping. That is to be differentiated from sleep apnea. In sleep apnea, there is a complete cessation of breathing, typically lasting for more than 10 seconds. Or it may not even be a complete cessation, Dr. Ogunremi. It might even be a partial cessation, a decrease in the breathing, oxygen saturation up to 4%, reduced oxygen intake up to 30%. We refer to that as hypopnea. I don't want to get too technical as yet, but regardless of if it's complete apnea or hypopnea, there are other associated factors or symptoms that will nail it that it's sleep apnea, or most likely sleep apnea. So gasping for breath during the night, somebody who wakes up was choking at night, wake up with a headache in the morning, you wake up tired in the morning, and you're also tired in the course of the day to the extent that you fall asleep easily when you're doing tasks. In some people, it can be so bad that they actually fall asleep while driving, which is not just bad, it's dangerous for all concerned, both the individual and the general public. And that is why this is a very important topic to talk about, especially people who have that should be sorted. And it doesn't just affect adults, Dr. Ogunremi, it also affects children. So children who have this, who snore, have apneic episode, it affects the learning at school. It can and does lead to, inattention at school. It leads to impulsivity, rebelliousness, learning difficulties, and behavioral problems. Affects the behavior. So they, throw up a lot of behavioral issues at school, and that has to be taken into account as well. And that is why if children, particularly in children, if they have or are suspected to have sleep apnea, we should investigate and obviously treat them even before school age, because otherwise it does affect their learning and attainment at school.
Wow, that's a serious one, especially when we look at the kids, because a lot of kids might be suffering from this, and then we're looking at something else because we're not taking, close look at this as an issue. So parents, please, let's look outside the box when there are issues, so that we explore things and deal with things, appropriately, and then solve problems that we need, that might be issues. So how if somebody then thinks they have it, and then we have says there are what looks more like maybe it is, maybe not, how do we then diagnose it? What are the diagnostic criteria, or what do we need to do?
Yes, that's a good question. So, like I said before, it's not something you, after listening to this talk today, I don't want you to go and look at, hear anyone snoring and say, yes, you have sleep apnea. So it is true that most people with sleep apnea do snore, but the reverse is not the case. So not, everybody who snore have sleep apnea. So snoring is key, plus all the other things that I've mentioned today. But also we use some screening tools or screening questionnaires. So for a start, a high index of suspicion, even a low index, let's just say, if your partner or someone is snoring, just get them to be assessed. So we should set the bar very low. If they snore and it's habitual, and you find that probably they're a little bit tired during the day, or falling asleep easily during the day, they don't necessarily have to be a big person. We should set the bar that low for them to go and get screened. So screening, we use lots of different tools in the practice to screen for sleep apnea. So we use what we call the Epworth sleepiness scale. We use stop bang, and there are other questionnaires that we use. But all these questionnaires, they take into account the following things I'm about to mention, and they're weighted or rated, weights and assigned to them in terms of numbers, and at the end of the day we'll make an assessment. So things like snoring, again, is key. If the person snores, if there's tiredness, if there's obesity. Also blood pressure, if the person has a high blood pressure, is also adds to the equation. We should talk about this, Dr. Ogunremi, because sleep apnea doesn't just affect all the things that I've mentioned. It also we now know that there is a link between sleep apnea and cardiovascular conditions. I'm talking about heart attacks and even strokes. So because the sleep-wake cycle, when you're choking, you're gasping, you're getting the brain to wake up, because when you stop breathing, the lungs send messages to the brain. The brain, particularly the medulla oblongata, that is a part that controls breathing, sends signal back to the lung to breathe. All that has burdens the heart, and over a long period of time can and does lead to cardiac complications. So blood pressure is a factor as well. I've mentioned BMI previously. If somebody is big, particularly BMI is greater than 34, neck circumference greater than 40 in women, 43 in men, gender being a man. There's also a role for genetics in all of this. So we also, one of the questionnaires also take into account your waist circumference. So waist circumference in men greater than 102 centimeters, or in women greater than 88 centimeters, are all significant. So all this is taken into account, and we arrive at a probability that says that, okay, you have a high probability that you have sleep apnea, or a low probability that you have sleep apnea, and then that triggers the next round of testing.
Wow. Okay, thank you so much. So that's quite explicit enough. And then one question that came to mind is, you know, we bang on about this, and we talked quite a lot about it. Is it really dangerous? Is it really dangerous, or is it something quite trivial? Why should I be bothered about it?
Exactly. It is really dangerous. Like I said earlier, it's not just about starting from children now. It's not just about affecting children's learning ability, and can stifle their potentials really from an early on in life. There's that. There is the risk of causing accidents, motor vehicle accidents, or those who've been operating machineries can hurt themselves. So there's a risk to road users, and that is why in places like, in most OECD countries, if you have sleep apnea, there will be a restriction on your license, and you would have to be monitored to ensure that you are optimally controlled or managed before you can drive, because of the dangers not just to yourself but to obviously the society. So it's important, and more importantly, equally important, is the effect on the individual's health. So I've mentioned cardiovascular risks. It's a significant factor, we now know, in heart attacks and stroke, that sleep apnea does affect those. And so it is serious, and we should take it seriously, Dr. Ogunremi.
Thank you so much. So we need to take it seriously. Now, if we are now thinking, okay, yeah, I think this might be an issue, or I need to go to the doctor now, let me just get myself checked. If I'm diagnosed with it, how is there option? Am I still going to be normal back? Are there things I can do to bring me back to to speed, as to I don't want to lose my license?
Let's be clear. Having sleep apnea is not a disability. So it's not a disability at all. Not treating it rather is the problem. That's what can get us into big trouble. So once we have a high index of suspicion using those questionnaire, the next phase is for us to move into some sort of diagnostic assessment, and we use what we call a sleep study, and there are two types that we do. We can choose to do a portable sleep study, a home study, and in most places, and including where I am, we use we rig the patient up and they go home and sleep on their bed, and we analyze the recording the next day. Or we can have a laboratory study where they actually come into hospital, have an overnight stay, and a study is done. So once a diagnosis is made, and I don't want to go too technical as to what constitutes a diagnosis, but we usually is the apnea-hypopnea index, anything greater than 5 per hour, and we sort of categorize that into mild, moderate, or severe. So most patients with moderate to severe sleep apnea will benefit from what we call the CPAP machine. So yes, to answer your question directly, you will lead a normal life, but you use things like a sleep apnea, which basically what it does is because what happens when you have sleep apnea is that you stop breathing at night, because this soft tissues in your upper airway, they collapse, they relax and collapse and block the airway. So with a CPAP machine, it produces what we call positive pressure airway into your lungs, your airway, and down to your lungs when you're when you are sleeping and solves that problem. But that may not be all you need to do, because if I mentioned a neck circumference greater than 43 centimeters, obesity, weight loss is always in the mix for people who are big. So in addition to using a machine, lifestyle modifications, losing weight, very important. Other things that is relevant, if you're somebody who smokes, there's nothing good about smoking, Dr. Ogunremi. So if you're somebody who smokes, that's not helpful. You have to give it up. If you're somebody who drink excessively, particularly shortly before going to bed, that would obviously exacerbate your sleep apnea situation. You have to curtail that. So all those measures need to be taken. Also, we know that some people, their apneic episodes is worse in certain position during sleep. So for most of us, because when we sleep on our back, there's more the likelihood that the structures in the upper airway will naturally, just as gravity will fall towards the airway and block it more. So for a lot of people, even sleeping on your side does help relieve or alleviate apneic episodes. And in milder cases, when it's not so severe, there's what we call a mandibular advancement splint. It's basically like a special mouth guard that you wear that thrusts your jaw forward and enable airway, enable you to essentially breathe better when you're asleep and unconscious. So yes, you will be able to lead a normal life. You'll be able to drive. You will be able to learn, do whatever you want to do, and lead a long and full life once you're diagnosed and you're receiving treatment. The reverse, the opposite will be the case if you do not seek help, you do not get diagnosed, and then you have sleep apnea. The incidence of sudden death would actually be higher. Your chances of having dying suddenly will be higher if you don't get diagnosed and treated as well.
Thank you so much. So the diagnosis, we know that it's easily done if an individual cooperates, and then we know that the treatment is there for them to have to get better. So what's the prognosis? How well do people do when they start these treatments on a scale? When we look at it generally, is it something that you get good results, or how do we perform on treatment?
They do brilliantly, Dr. Ogunremi, and that is the beauty of it, of this condition. It's a condition that causes so much problem, but at the same time, treatment is very simple, and people respond to treatment. Can I just quickly circle back and talk about, because like I mentioned, this condition also occurs in children, and sometimes is due to anatomical abnormalities. I mentioned tonsils being a problem, and large tonsils, also deviated nasal septum, narrowing the airways. So not all sleep apnea is caused by all the things that I've mentioned, but this anatomical structures can also cause sleep apnea, and the management of those is actually different. So in children with enlarged tonsils or adenoids, so they will actually need to have surgery, have their tonsils removed. We call that tonsillectomy, and perhaps adenoidectomy as well. And that frees up the airway and increases the caliber of the airway and makes them breathe better. And the result is spontaneous. So basically, you have a child who's snoring, not listening to his parents, being naughty, inattentive, having behavioral issues, and then suddenly the child has surgery, and bang, the child comes alive and begins to get good grades at school. So the prognosis in that sense is actually quite good. And similarly, people with deviated nasal septum, they have what we call a septoplasty, which is basically refashioning of the nose and lining the septum of the nose properly, and that increases the caliber of the airway. And some people, it might even be deviated nasal septum. It might just be things like polyps, like what we just think of it as skin tags in the nose, and that also narrows the airway. Removing those and just creating a better airway passage improves their symptoms, and the prognosis is excellent. Similarly, in those who we treat with CPAP machine or APAP machine, the prognosis is really good. Typically I have patients who come to me because in the introduction, Dr. Ogunremi, you mentioned sleep problems. So there are patients who for many years would have been taking sedatives because they're sleeping poorly. I can't sleep well at night, they will tell you. Wake up tired, give me sedatives. Some of them have been using sedatives or buying over-the-counter sedatives when they can, thinking that is their problem, but the problem is actually sleep apnea because with sedative, that actually makes it worse. So typically I've had a few patients come and tell me that, once they started on a CPAP machine, that I've had the best sleep of my entire life. You get such testimonials from patients, and then it only gets better from there on in. And in also saying that we do not just hand the patient a CPAP machine and send them on their way. Most CPAP machines nowadays, they have a SIM card or a chip. So we encourage patients to use a CPAP machine and do a download of the chip and send to us to analyze, maybe periodically, monthly or quarterly, and you can see what's happening to this. And they can also see what's happening to their sleep, and you can obviously adjust the machine accordingly, because it's not just fit and forget. You need to adjust them periodically and make sure that they're getting the best out of it.
Thank you so much. It's been a very enlightening period, even for me, as a colleague, and I'm sure our viewers in at home will have benefited quite a lot around the discussion today. So thank you so much, Dr. Mbaogu, for this enlightening session. Now, as we'll be rounding up, what are your parting words to the viewers at home? And possibly, we know that our health system, you are there in Australia, health system in Nigeria is a little bit in shambles at the moment. Whether there's a way you can also, throw some word of advice to our government on things that we need to be doing, because the system has to be, all these nodes that need to plug in together. And the management of cases like this is one of those things that I'm pretty sure is missing. So what are your parting words to our people?
Thank you, Dr. Ogunremi, for this opportunity. I would like to say that anybody who's listening, and it doesn't matter where you are in the world, when it comes to health, you should not wait until you are unwell to see a doctor. Everyone should go for periodic health check from time to time. So there's nothing wrong with you. You feel that there's nothing wrong with you, but go to the doctor, go and get checked. The doctor should check your blood pressure. The doctor should check your simple things like your sugar, check your kidney health, your liver health, see how you're traveling. Even your mental health should be assessed. And also it's doing, interactions like that the doctor can ask about things that we're talking about today, sleep apnea. So it is better to prevent things or to catch things early, make diagnosis early. And it doesn't matter if you're a man, Can I just say this, that some men think that going to the doctor and opening up to the doctor make them less of a man. No, it actually takes a man with grit and guts to go to the doctor and open up to the doctor and talk about everything from mental health to their physical health. So it's not just women who need to be screened periodically for breast issues or cervical issues. We all need to be screened, including men. And I would like to call on everyone to go for periodic health check and do not wait until you are unwell before you present to the doctor. Because if that is all you do, if you only go to hospital or to see the doctor when you're unwell, you're more likely to, the outcome is likely to be poorer than if you were periodically seeing a doctor and getting checked and nipping things in the bud, as it were.
Thank you so much for that word of advice. And on these notes, we will be rounding up this session, while we'll be looking forward to another, episode that'll be coming next week. Now, to the viewers at home, thank you for always being there. We really appreciate you. And Dr. Mbaogu, I want to especially thank you once more for this enlightening session. And for the rest of the weekend, I wish you all the best. And I'll see you next week, same time and same channel. Thank you. Bye-bye. Have a lovely day.